Okay, we're going to do trach care, some clean hygiene stuff. We're going to verify our physician's orders. He said to do it. Now we're going to identify our patient. His name is John Doe. What's your name? John Doe. What's your date of birth? 1/1/1990. If he has a bracelet on, scan the bracelet, barcode, validate it with a computer. Okay, I'm going to wash my hands. Then I'm going to don my gown, mask, my gloves. Okay, we're going to remove our soiled dressing. Okay, we're going to discard that. We're going to remove our dirty gloves. At this point, prior to removing our gloves, we would hyperoxygenate the patient, whatever means they're receiving oxygen, whether it's by nasal cannula or through the vent or through room air. We would increase that oxygen. If it's on room air, we tell them to take 5 to 6 deep breaths in and prepare. So I'm still gowned, mask, just took my dirty gloves off, gonna wash my hands. Now we're going to get ready to open our sterile containers. We've got our sterile water. While the outside of it is clean, I'm just going to loosen my cap, set it over here to the side. And then we've got our container. I'll open it away from us. Okay. Gonna get my sterile gloves. I don't like these gloves. Pause it. Okay, we're going to don our sterile gloves. We're going to remove our pack. Open it. Making sure only to touch the outer edges. Okay. Do our dominant hand first. Our dominant hand. Get rid of that. Get our sterile drink. You wouldn't let it just fly all willy-nilly over the table. Okay. And then, while my hands are still sterile, I can get the peroxide, pour it in one, discard. It came with 2 packs of peroxide, so I guess I can fill it up again. And then I want to remove the contents, get my brush out, my gauze, my split sponge. My little bits and bobs. Okay. And then I'm going to contaminate my non-dominant hand. Gonna remove this while I'm at it with the label facing into my palm. Just gonna pour a little bit over into the container. Okay. Now I'm gonna remove the inner cannula. I can touch the little cinches. Excuse me. So, touch the little, drop it in the peroxide. Okay. So now, I let that soak for a moment. I can begin cleaning the faceplate and around the stoma with the Q-tips. So we got our Q-tips. Gonna get them in some normal saline. Come over here, and just like a wound, we're gonna clean from the wound outward so we're not pushing bacteria in. Let's see. And just clean around that and clean out, and discard. And then grab us another. Get it in the normal saline. Come out, we're gonna clean our faceplate, get it all nice and shiny. Discard. And then I went and dropped my hand below my waist because that's breaking sterile field. Hands above the waist. Get my sterile gauze. I can come over here and pat, discard. Pat, discard. So we've cleaned it. Now we're going to move on to the inner cannula with my non-sterile hand. Pick it up by the outer portion that does not go in the patient. We're going to take our little brush. We're going to take our little brush and clean the inside of the cannula, scrubbing it from both ends, getting all the junk out. Put that there. Now we can begin to dry it with the pipe cleaners. Clean it. Clean it. Put it back in. Kind of difficult to do on these dummies. Just going to contaminate my hand. There we go, friend. Listen for the click. Okay. So, now we're going to take our sponge. We're going to stick it up under there. We're going to use a sponge, the pre-cut sponge. We're not going to cut gauze. Okay. Nice and clean. And if the straps are dirty, we can take the other straps, replace it. You're going to put the new ones on before you take the old ones off. Okay. Tie those securely, and then we can remove the Velcro from the other one and remove that one. Ta-da.